Welcome to Equal Dose, the podcast that delves into the factors shaping our health and explores how we can create better, more equitable outcomes for everyone. I'm Matria Godfrey, joining you from Washington, D.C. In each episode, we address pressing challenges in health equity, sharing expert perspectives and inspiring stories that drive change for a healthier world. Today, we are looking at strategies to prevent violence in our communities. We'll be joined by Phyllis Ottley from the CDC.
We know that experiencing violence has a profound impact on lifelong health, on opportunity, and on well-being. Individuals exposed to violence are often at higher risk of experiencing other forms of violence. But the good news is that violence is preventable.
And Jeff Temple, director of the Center for Violence Prevention at UTHealth.
We know for the most part, what works to prevent violence and what works to prevent injuries and falls and drownings and suicide and firearm violence. The problem is how do we get it out to the community?
But first, we want to make this disclaimer. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Now it's my pleasure to welcome Layla Rizvi, Director of Strategy and Research at WebsEdge, the company behind this podcast. Hi, Layla. Great to see you today.
Great to be here today.
All right. Well, unfortunately, we do have to turn to a sobering topic today, and that is levels of violence. In the United States in 2020, around 75,000 people died of violence-related injuries in the United States. Just unbelievably staggering numbers.
Biggest question on everyone's mind is obviously what's caused this, and you could probably say factors related to the pandemic, both directly and indirectly, but also what has sustained it, because it's been a good couple of years since the pandemic, right? Where have we gone wrong, particularly amongst youth? That's what's most astounding, that I believe homicide is the third leading cause of death for young people, ages 10 to 24, which is crazy.
Third leading cause for that age group, 10 to 24. I mean, 10 is so young. It'll be interesting to hear how much of a role gun violence plays in those numbers. Of course, we know that some youth are at greater risk than others. So how do we, target those underserved communities and make sure that those youth are really being prioritized for their own safety? Youth violence is very costly. In 2020, which, as you mentioned, was at the height of the pandemic, youth homicides, though non-fatal physical assault-related injuries, resulted in around $122 billion for the U.S. And we're talking medical costs, loss of work, quality of life. That estimate, it's interesting to point out, does not include costs to the criminal justice system. Compared to 2019, the economic burden of youth violence was 17% higher in 2020. So it'll be interesting to see with our guests today if we have progressed from those numbers over the last 3 to 4 years. And we will be talking, about how they are really going after trying to prevent that youth violence. And that is, one of the key areas of focus for his organization.
Yeah, and I wonder how it's also varied across the country and whether there are pockets which kind of correlate with certain socioeconomic factors.
Public health relies on a multidisciplinary foundation incorporating fields like medicine, sociology, and economics to address health challenges. Phyllis Ottley, Associate Director for Programs at the CDC, joins us to discuss how collaboration across these sectors, such as health, education, and policy, is key to solving complex issues like violence. Thank you so much for your time today.
Thank you very much for having me.
Certainly. Okay, let's just dive right in and start off with, why is it important to view violence as a public health issue rather than just, say, a criminal or societal problem?
Everyone is impacted by violence one way or another, whether directly or indirectly. It's likely that even you or someone you know have experienced or been impacted by violence. And this is what really makes it a public health problem. The focus of public health is on the health and the safety and the well-being of entire populations. And we know that youth and community violence, for example, are a significant problem, but they're also preventable public health problem that results in the loss of thousands of lives each year. Sadly, homicides are a leading cause of death among young people in this country. It is the second leading cause of death for youth ages 10 to 24, and the third leading cause of death for young adults ages 24 to 34. Young people who experience violence have higher risk for experiencing future violence and other challenges such as substance use, depression, or suicide. And so public health really has that long history of working with these multiple sectors in the community to improve the health and the well-being of entire communities. And the efforts to prevent violence takes into consideration many underlying factors, such as what I mentioned about substance use and mental health problems, and those go way beyond the reach of the justice sector.
Dr. Ottley, could you explain to us in a little bit more detail how the CDC's public health approach helps prevent violence across communities?
A public health approach strives to provide the maximum benefit for that largest number of people. And the CDC uses a public health approach to prevent community violence by first collecting data to really help us to understand what the trends are and the differences across groups. And then we also use it to conduct and to fund research to understand what works to prevent violence. And then we share that information to help states and communities make the informed decisions about their prevention activities. Through the public health approach, we can identify those factors that put people at risk for experiencing or engaging in violence, and then the factors also that protect against violence, like having some strong connections to a family or a caring adult. The public health approach also emphasizes input from diverse sectors, including health and education, social services, justice, policy, and even the private sector. And so it's really that collective action on the part of these key collaborators that can really help in addressing problems like violence.
When you talk about gathering data to try to understand the causes and the effects of violence, what are you looking for? What does the CDC look for when it comes to that data?
First, data can tell us who is at greatest risk, what's contributing to violence, and then what's also helping to create safety. At CDC, we have several different data sources that really help us to monitor the burden of deaths and injury, and also to capture the full picture of what violence occurs and then where it's occurring, and then the behaviors and those circumstances that can make experiencing violence more likely. And so we have a couple of examples. We fund 50 states and territories to establish the National Violent Death Reporting System. And this system really helps to link information about the who, the where, the when, and the how violent deaths occur. And it also provides us some insights into why those deaths had occurred. We also have the Youth Risk Behavior Surveillance System Survey, which asks U.S. high school students health-related behaviors that contribute to the leading causes of death and disability among youth and young adults. And so one example of how we use this data to help focus prevention is to really help us to identify those populations that are most risk for violence. And so just with that Youth Risk Behavior Survey, the 2020 results show that the percentage of students overall who were threatened or injured with a weapon at school increased from 7% in 2021 to 9% in 2023. In that same survey, the percentage of students overall who were bullied at school increased 15% in 2021 to 19% in 2023. So, these data really have the potential to highlight prominent areas of concern. And really by understanding these trends and the factors that drive, those inequities in the risk for experiencing violence, CDC can really coordinate efforts to focus kind of the resources and the areas where federal public health investments can really help to accelerate the progress and to make the most difference.
What are some common risk factors which increase the likelihood of violence, and what are some conversely protective factors? On that as well, what do you think might be some very underappreciated factors which a lot of people might not be aware of?
We know that youth and community violence is not often caused by a single factor. It's a combination of factors at multiple levels, and it includes at the individual level, at the relationship level, at the community, and even societal levels. So it's really all these different levels that can increase or decrease the risk of experiencing violence. And so, for example, some factors that put people at risk for experiencing violence include, growing up in a community with concentrated poverty, or even having low parental supervision, having exposure to substance abuse, either in your home or in the community, and then also just having unstable housing. Those are some things that put people at risk for violence. On the other hand, a young person's skills, their experiences, the relationships they have, and then the community can really help protect them from violence. And so these include things like having high academic achievement, or having these very strong connections to family or to their trusted adults, also having close relationships with some supportive peers, and really just being involved in some positive kinds of activities.
You mentioned the survey that you give to schools and high schoolers, and kind of the data that you are able to glean from that. How do you take that information and work with the schools, families, other members of the local community in order to create programs to try and prevent violence?
Violence is not just a problem for the police or just for some communities, right? We can all play a part in preventing violence and to create these healthy and safer neighborhoods. And so at CDC, we fund research on what works to prevent violence, and then what works with recipients to implement those strategies. And then what we also do is communicate about the impacts of violence on health and well-being. So we fund these youth violence prevention centers. We fund these centers with academic institutions. And the prevention centers really help communities to identify and to test innovative violence prevention approaches in communities. So one example is in Kansas City. This prevention center is expanding the evidence base for participatory type strategies to prevent youth violence, particularly among Black and Latino youth. And their one strategy is called Revive. It's reducing the effects of violence through intervention and victim empowerment. And this is really a scaled, multi-site, hospital-based violence prevention program. The project examines change in the community conditions, including those that increase the risk and also protect against firearm-related hospital admissions and youth homicides. We have another program that's called Preventing Violence Affecting Young Lives. And this one funds recipients to address youth violence. It also addresses teen dating violence and other adverse childhood experiences. And these are all these conditions that put communities at greater risk for violence. And one example is in Multnomah County in Oregon. They've developed and they've implemented a crime prevention through experimental design programs in high crime neighborhoods. This program is again working to increase that community connections and to create safer neighborhoods by cleaning the vacant lots and beautifying the neighborhoods. And so, community violence is really a multifaceted type public health problem. And it requires collaboration from multiple sectors and also multiple types of organizations. More importantly, strong partnerships with the community. And so the hope is that, everyone can play a role in putting evidence into action, so that we can work to create a more violence-free society.
So, Dr. Ottley, you've obviously discussed and mentioned examples of numerous prevention programs. Are there any prevention strategies which you think are particularly novel or have taken you by surprise in their success?
First, it does take a comprehensive approach, as I've been saying, to kind of mitigate the effects of violence and to prevent future violence. The strategies that address those underlying social and economic and those structural conditions that are known to increase the risk for violence, those strategies are really the most essential. And some of these strategies will be more immediate, right? And then while others will have more longer term effects. And so, for example, we've got these policies that enhance economic and household stability. Those can really improve the positive outcomes and help to reduce stress, help to reduce family poverty. We found a study of the state earned income tax credit laws. And this study found that implementing a high state earned income tax credit was associated with a 10% lower violent crime rate. We also can improve the physical conditions within communities that also increase the risk for violence. And then just lastly, we've got also another example is street outreach and hospital-based interventions. I talked about the one in Kansas City, where it can really ensure that people with the greatest needs are connected to services. And then they're also working to reduce the tensions and the risk for violence. And so these hospital community partnership models, they've really shown to promise in reducing the risk for violence among youth during a time when, they might not be, or they might be particularly open for change. At CDC, to help communities decide what programs and policies and practices to use, we have developed a series of prevention resources for action on our website, and that describes the best available evidence to prevent violence.
Dr. Ottley, I'm sure this is the million-dollar question and one that's hard to nail down to just one answer, but what would you say is one of the biggest challenges that you face when it comes to preventing violence? And also, what can communities do? I mean, you mentioned that the communities that have the highest level of engagement seem to see the most progress. So what can communities do to become more engaged?
Right. One of the biggest challenges in violence prevention is the lack of resources for this work. Prevention really takes time. And when cities and communities are, faced with limited resources, they often have to choose between investing time and resources, into more upstream type prevention, or just try to handle the problem, immediately. And many communities, are already implementing some effective strategies to prevent community violence. And for ways to help prevent community violence in your community, we ask that people check out the strategies and approaches in CDC's Community Violence Prevention Resource for Action. They can either use that to begin new efforts, or they can kind of expand on existing efforts that they may already be doing in their community. And then we also have, for additional guidance on how to select and implement the strategies in that resource, we should also visit the Violence Prevention in Practice site. This is on our Veto Violence website. Here you can find implementation guides that are designed to support state and local health agencies and other interest holders who have a role in planning and implementing and evaluating these violence prevention efforts.
If you could nail down what is the single most important thing that people should know about preventing violence, what would that be?
We know that experiencing violence has a profound impact on lifelong health, on opportunity, and on well-being. And as I mentioned earlier, individuals exposed to violence are often at higher risk of experiencing other forms of violence. But the good news is that violence is preventable. And everyone really has a role in preventing violence and creating that healthy, safe, and thriving communities. We can all take proven actions in the communities to reduce violence. So, for example, we can engage with local community organizations like the cleanup of vacant lots and that I described, or beautifying our neighborhoods. We can also discuss the importance of securely storing firearms in our homes with friends and with family. If we notice if youth or young adults in our community seem withdrawn or stressed, and talk about experiencing violence with them. So really, it is the collective action that can really help us all address a problem like violence.
All right. Dr. Ottley, thank you so much for your time today and for all of your information and your insights. And best of luck in all your future endeavors. We appreciate everything you're doing.
Well, thank you so much. And I appreciate you allowing me to talk about this very important topic.
So, Layla, I think it's interesting that really when it comes to every facet of violence prevention, Dr. Ottley kept going back to community involvement. It takes a village. Like the more people, especially when it comes to preventing youth violence, the more adults that these youth can get in their lives that offer them a sense of stability and security and direction, the greater the likelihood is that they might break the cycle of violence.
Yeah, and I think, again, it's those like basic factors and the multifaceted nature of the things that impact youth violence. I know Dr. Ottley also mentioned just like academic performance can impact whether you are more susceptible or vulnerable to engaging in youth violence. Relationships was something else that she mentioned. And also that violence is not just the concern of kind of law enforcement. There are plenty of professionals and specialists that have to be involved. It's just all about that collaboration and that community.
Now we're joined by Dr. Jeff Temple, director of the Center for Violence Prevention at UTHealth Houston. The center is dedicated to reducing violence in Texas and beyond through cutting-edge research, evidence-based practices, policymaking, and collaboration with community partners, and supported by organizations like the NIH and the CDC. Welcome, Dr. Temple. Appreciate your time today.
Thank you so much for having me. I really look forward to it.
Certainly. I want to get started with if you could kind of set the stage for us and how big of a problem is violence in Texas? Where are you starting from?
It's a huge problem globally, nationally, and certainly within Texas. We're not immune from it. If you look at things like firearm violence and suicide and even maternal morbidity and mortality, all that is really heavily an epidemic. I mean, if you look at just that latter point that I made about maternal morbidity and mortality, we have millions and millions of dollars focused on things like ectopic pregnancy and physical causes of that, when in reality, over half of them are caused by suicide and homicide. So really taking a step back and looking at our public health problems, violence, intrapersonal, so suicide, self-harm, and interpersonal violence, like domestic violence and firearm violence and gang violence. Those are really our overriding problems in society that cause a substantial amount of fatality and injuries throughout Texas, throughout our country, throughout the world. And lastly, my last point with that is firearm violence is the number one killer of children right now in the United States.
So your center, the Violence and Injury Prevention Research Center, it's the first of its kind in the Southwest. Can you talk a little bit more about the mission, and also is there a significance to it being located in Texas?
Yeah, so we affectionately call it Viper. We really do want to be a worldwide leader in injury prevention and really focused on outreach, training, education, and research. And our goal is lofty. We want to eliminate the burden of violence and injury through increasing the number of folks that are interested in violence and injury prevention research and training and outreach. One of our biggest plans is to be a cheerleader for this type of work. Obviously, we're going to do the work ourselves. We're going to be a clearinghouse for people looking for resources. But really, we want to market the importance of violence and injury prevention throughout the spectrum of the lifespan and the different spheres of the social ecology, from the individual to the family to the school to the community to society at large. We really want the focus to be on what can we do to prevent violence and injury, but maybe even more importantly, how can we get that word out? How can we get people to start taking up these violence and injury prevention programs and causes? Because we have a really good idea of what works. It's a matter of getting it out there into the community and implement it in a way that's going to be sustainable. And as you mentioned, Texas, why does it matter that it's in Texas? Well, up until now, the Injury Control Research Centers funded through CDC have been primarily bicoastal, so on the West Coast, East Coast, and a couple in the Midwest. So this is the first one, as you mentioned, in Southwest Texas. So we have a lot of catching up to do and a lot of work to do to eliminate that burden of violence and injury in this region.
You've described the center as transformative. In what way?
One, we are going to focus on implementation science. And so that is going back to what I just said, is that we know for the most part what works to prevent violence and what works to prevent injuries and falls and drownings and suicide and firearm violence. The problem is how do we get it out to the community? How do we get it out to adapt to the real world? So we're really going to focus on the best practices for adaptation and use in the real world. The second is our focus on equity and making sure that it is throughout our programs, and our model is that we give community as much power as we have. At the end of the day, we are scientists in our ivory tower, and what we think people need or want is probably not what people need or want. So we want the community to have an active voice, as strong of a voice as we have in what issues we decide or go after. We want to have this community-based participatory research. So this goes back to what we just talked about. Every level of what we do is going to involve community members. We don't know best. We are not the experts in an individual neighborhood or a school or a community or a city or a state. The people, the residents, they're the ones that know what works, what doesn't work, and we're going to listen to them.
Dr. Temple, you've mentioned a lot about collaboration and community collaboration, as well as collaboration between various institutions. So I understand VIPER is a collaboration between UTHealth Houston, Baylor, and the community. How important would you say this collaboration is in helping you achieve your goals, especially in terms of implementation that you mentioned?
I really live by the whole is greater than the sum of its parts, and we cannot do any of this just by ourselves, just with us, just with me. We're all hard workers and we care a lot, but it doesn't matter if we're just trying to be out there doing it. We're just not going to have an effect. So we have to have these other institutions, community members as part of our team and to really get the ball rolling and get moving and to have an actual impact.
And I want to go more into kind of policy and policymakers. Could you provide an example of how your research might directly be influencing policy in the context of violence prevention?
You know, we have our center is also unique in that we have a director of health policy research, Dr. Shannon Gio-Wright, and she has extensive experience working with policymakers. So she's worked on Capitol Hill, she's worked in Austin, and has worked alongside policymakers and has really taught us the importance of meeting policymakers where they are. So not trying to give them our dissertations and expecting them to read it, to really asking them how we can help them as opposed to telling them what we want to happen. So we ask them, we try to be partners with them and give them stories so that the research is, contextualized. And you asked for an example. One thing is we have done a lot of work with policymakers in trying to reduce firearm violence, especially the intersection of firearms and domestic violence. And so we have worked with them on red flag laws and on closing the boyfriend loophole, which is, that historically, if there's domestic violence, the perpetrator is not allowed to purchase a firearm, but that did not extend into boyfriend-girlfriend relationships. So trying to get it to extend there. And we've used stories like there was one woman who said, my husband owns a gun. He's never used a gun on me. But, after we get in an argument, that's always when he decides to clean his gun. Mm-hmm. So we use those really impactful stories to work with policymakers on the importance of things like red flag laws.
I'd like to stick with kind of some of the particulars that you've already mentioned as far as your areas of focus. Violence across the lifespan, suicide, adverse childhood experiences, firearm violence, which you just touched on. Can you give us any type of examples of some of the areas of progress, I guess, you're seeing with these specific focus areas and why you chose these specific areas or these specific issues to focus on?
The idea of violence across the lifespan is interesting to us, and we are unique. In centers is that our initial focus is heavily on violence and intentional injuries. That was purposeful to take advantage of our strengths and what we do and what we have done and the interventions we've implemented. The importance of looking at violence across the lifespan is not just focusing on child abuse or dating violence or partner violence, because they don't happen in silos and vacuums. It is, we see it as developmental, that kids that are in abusive homes are more likely to be abused and abusive themselves, are more likely to be depressed and die by suicide. So they all sort of cluster together. So I think one of the important things is, you mentioned firearms, suicide, violence, adverse childhood experiences, is that we need to target the shared risk and protective factors of all of these multiple problematic behaviors, as opposed to what we've been doing as a nation and as a world, is looking at them separately as in silos. And that's just an inefficient way of working.
And I know that your organization provides technical assistance for schools. Can you talk a little bit about that and kind of how you're utilizing, schools to try to, I guess, reach those kids at that very vulnerable stage who might be a part of those, households where they're seeing some violence to try and, stop that cycle?
One of my favorite quotes is by FDR is, if you're going to do anything for the common man, you have to start before he becomes a man. Mm-hmm. And so that's where we really focus on youth, adolescents especially, in that critical area when they're old enough to take in this information, but not old enough to start developing this pattern of negative behaving. So what we really have focused on and what we worked with schools on is these school-based interventions. And yes, we hope they get it at home. We hope they get this important information at home. We hope they get it at church. But, there's going to be a lot of folks who don't get it at home or at church or the community. So school can be the extra belt and suspenders approach to make sure that we catch those kids who don't get any of that information at home or at church or in the community. And the worst case scenario is the kids that do get that stuff outside of school, now they just get reminded of it and the importance of it during school. So we have a program that's called 4R that we borrowed from our friends up north in Canada, which focuses on teaching kids how to be in a relationship. So giving them relationship skills. The 4 R's is reading, writing, arithmetic. The 4th R is relationships. Basic things like, how do you apologize to someone? How do you break up with someone? To more complex things like, how do you resolve arguments in a non-violent way? So really trying to get everyone on the same page that in schools and communities is a focus on safety.
What age group are you talking about here? Because you mentioned you want to get them at that critical age range where they are aware enough to know, hey, yes, this is something that's happening inside my home, but yet they're not already exhibiting those behaviors. So are we talking elementary age? Is that too early, or is middle school too late?
It's never too early or too late. It has to be developmentally appropriate. And if I had all the money in the world and all the resources, I would start at the womb and have programs throughout childhood and into young adulthood. But since I don't have all that, I really think the sweet spot is 7th grade. So middle of middle school, where they're starting to be a little bit more precocious, but not to where they're have really developed that pattern of negative relating.
And I know you hope that over time you can expand your areas of focus to address some unintentional injuries like car crash injuries, unintentional drownings. How do you hope to try to balance the broad scope of injury and violence prevention all under the one umbrella of your center?
That is going to be a challenge. It's going to be tough, but it goes back to collaboration and working with people who are smarter than me and harder working than me, which is hard on both accounts. But yeah, I mean, I certainly can't do it alone. Our center, as it's currently built, can't do it alone. So we have to recruit and work with other institutions, other scientists, and especially the community in making sure that we can reach our ambitious goals to focus on intentional and unintentional injuries.
Is the biggest barrier to that, though, funding?
I don't like when we put that on as a barrier. Funding is hard to get, it's difficult, and we need it to do it. But we're prepared to work even without funding. Hopefully we'll get funding and continue to get funding, and that'll make our work a lot easier. But we're not going to let that be a barrier.
And Dr. Temple, I just want to finish up with one final question about the future. Looking ahead 5 or 10 years, how do you hope the work of the Viper Center will shape the field of violence and injury prevention?
I would like to look even further and look into 20, 30 years when I'm retired and someone has taken over this job, and that we can look at data and say that this center really did work in reducing, hopefully eliminating in some cases, the burden of injury and violence. In the near term, 5, 10 years, I hope that we see some of that. Prevention takes a long time. But I hope we see some indicators of our success. I know we will see indicators of our success, which is going to be, of that long-term success, more people thinking about, focused on, working on, training, educating, doing violence prevention, injury prevention work in the community.
Absolutely. Well, thank you so much for joining us today. It was wonderful to have you.
I really appreciate it. Thank you so much for having us and for focusing on this work, the whole thing I'm trying to do.
So, Autria, Dr. Temple, incredibly interesting what he was saying, particularly about violence across the lifespan and how if he could, he would start violence prevention in the womb.
Right. Because I think when you think of, violence prevention and talking to youth about it, you think about, you're talking about really heavy topics.
Yeah.
But what he did, I think, was lay it out in a way of, especially when you're talking about, kind of borrowing from Canada and implementing like the 4 R's, the last R being relationships. He did boil it down into a way of, no, you can go in to schools and talk to children as young as, kindergartners, just about how to have a relationship and how to, work with somebody or, apologize. And it's interesting to me to think I have 2 little kids, one of which is a kindergartner, to think that I guess those are things that aren't being talked about in every single home. And, how to get along with people, how to not escalate a situation or how to de-escalate a situation,
Just that point about, those very basic things like healthy relationships, which actually a lot of us take for granted. And I think when we're talking about violence prevention, we jump straight to, the big guns. We don't have to jump to the really stark, obvious things, because actually it's kind of small steps and the very small things which we neglect because we don't really think that they're that important, which actually have the biggest impact. And the power of kind of compounding that, if you compound those smaller things like healthy relationships and just those basics at a young age, you really compound quite a large defense and prevention mechanism against violence, and particularly youth violence.
Violence against women and, homicides involving women who are in a domestic situation. It made me feel good to hear that one of the big policy issues that they are tackling is, getting those restraining orders against a boyfriend-girlfriend type situation, when I guess it had originally only been intended for people in a married situation.
Yeah.
So, that's encouraging. It's like, okay, we're finally realizing that, domestic violence can occur, outside of a legal married situation.
A lot of policies are just, outdated and they don't align with, what is the standard in the modern world.
Some of these laws are very antiquated, so it's good that they're finally taking a step back and looking out for women. That's all for this season of Equal Dose. We will be back later in the year with more insights. If you've enjoyed the show, please make sure to like and subscribe, as it really helps us to create better content for you. Thank you all for all of your support. Equal Dose is brought to you by Webb's Edge, and we would like to thank researcher Maddie Horn and editor Abby Harries, our studio engineers Adam Dean and Sam Saris, graphics designer Matthew Coleman, and producer Kath Sheehan.